Welcome back to West Texas View.
Welcome back to the West Texas View. Dr. Bobby Jane, head of the Psychiatry Department at Texas Tech University Health Science Center, is our guest today, and we've been talking about all of the aspects about seeing a psychiatrist and some of the ways to make sure that you're expediting that visit with a psychiatrist so that he or she can give you the most help that you need, or your children the most help that they need. And another question that was called in after he was here the first time was, if you have bipolar condition, which for layman we call it manic depressive condition, is that a lifelong problem that you'll have to be treated forever, or is that something that's curable?
Unfortunately, this is a lifetime condition. The example you talk about bipolar disorder, it is a lifetime condition. However, having said that, bipolar disorder adequately treated should not stop anybody from doing whatever they want to do in life. A very, very normal life. They can have kids, they can have very stressful, productive jobs, they can take any responsibilities they want to, they can climb mountains, they can go to space, whatever they want to do. I'm just giving an example here.
But if they don't take their medication, then it's just like diabetes.
Right.
Everything's
Exactly.
going to go
just
off.
Like yes, exactly. You got a very good example there. Just like diabetes, that requires hands-on approach all the time. If you don't take your insulin, your blood sugar gonna go haywire. Same with bipolar disorder. If you take your medications and they're adequately controlled, adequately tuned in, then your mood should not fluctuate, and you should be able to lead a normal life. Now, again, going back to the example of diabetes, there's always precautions you have to take. For example, if you're taking insulin and your blood sugar is very controlled, that doesn't give you a green light to eat whatever you want to eat. You still have to maintain a very strict diet. Similarly, with bipolar disorder, if you're taking medications, you really have to make sure that your lifestyle is very modified in terms of having adequate sleep, not using any substances, or using substances in very moderation. I'm talking about alcohol, for example. It's good not to use them, but have a very balanced lifestyle, exercising, adequate sleep, and trying to maintain stress within normal limits. Those are the factors. If you maintain that along with medications, there may be ups and downs. You may need tweaking here and there. Just like any car you can buy the most expensive car. It still needs some tweaking and some adjustment. Same way over here. You may need some tweaking here and there, but you should be able to live a very normal, productive life. But it's a condition that is lifelong and that requires medication. That's true.
Okay, good. Well, and this was an adult, but am I correct that a child can have bipolar?
That's true. We did not believe that children could have mood problems 25, 30 years ago. But now we're understanding that because it's a genetic condition, some kids may have onset of bipolar symptoms much early in life, much in the first decade of life.
And so a long time ago, they may have treated bipolar in a child as HDD.
ADHD, absolutely. Even now, what is more fascinating and ironic is that ADHD tend to hang around very closely with bipolar, and the symptoms overlap. That is why it's so difficult to diagnose and differentiate. A lot of bipolar disorders are missed or wrongly diagnosed with ADHD, and vice versa. And it takes about, average time in adults particularly, it takes about 8 to 10 years from onset of illness to adequately diagnosed. So it takes so much of time because it's so difficult to recognize it. What is more difficult is that the symptoms in children are very different in bipolar disorder compared to adults. Children are more likely to show irritability, mood problem, withdrawal, compared to in adults where you see more like euphoria, hypersexuality, impulsive behavior. So there's a little bit of difference in presentation, even though the condition is the same. So it takes, yes, conditions can be very different. The condition can start very early. It can be masked, and because kids are evolving and growing and influenced by environment around them, it's a very complicated picture, and it takes years of experience. That's why to treat children, they require 2 years of additional training. And I would say, looking back at my training, that was just the beginning. You learn every single day, and every patient
with
is
every patient.
Every patient is your teacher.
But the interesting thing is there's really nowhere else to go to get that help except to a psychiatrist and to a psychologist.
Yeah, lot of I wouldn't say except for that. A lot of community regular doctors over the years feel comfortable dealing with kids, even with adults. Most patients are more comfortable seeing their regular doctors rather than going to a psychiatrist. I would recommend that go to see someone, start the process rather than hoping to wait and see a psychiatrist. If you're very comfortable with talking to your OBGYN, or you are comfortable talking to your regular doctor, go and talk to them. They are still doctors, they know their condition. They may do the first line of intervention. They may probably start you with medication, maybe give you some relief. Maybe that will work. But if it's not working, maybe that's the time when your doctor will refer to us. So at least you will get some starting on the treatment intervention started, and hopefully your suffering will be much lessened. So start somewhere. Psychiatrists are far in between, difficult to get. I understand that. I'm guilty of it myself. But start somewhere. Regular doctor, OBGYN, whoever you can find. Go get some help.
Well, one of the things that you had said earlier was that there's a lot of ways you can do your homework before you get to a psychiatrist. But we're talking to a whole audience that's spread out over the whole Permian Basin. And some of those don't even have a doctor in their little communities. And so they have to come to Odessa or to Midland or to Big Spring or even to El Paso to get to a doctor. And so that really spreads out then if you're going to a psychiatrist in one town and a internal medicine doctor or a OBGYN in another town. But we've got such a great network now that we all talk to each other. Technology allows us to pass things back and forth and be able to do that.
Very important. Now, the Texas Tech is trying to develop a program where what's called telemedicine, where we can connect through internet and through cable lines patients which are far apart. And it's a small starting. We just started that program. I think the pediatrics is probably doing that, but it will probably translate into other specialties where I will be able to see patients sitting 100 miles from here, and they don't have to travel 2 hours, 3 hours to come to see me.
That is a great wave of the future to be perfected. And in fact, there's so much going on with Texas Tech University Health Science Center that is going to really pave the way into a new era of medicine. And so it's exciting, isn't it, to be in on that bottom floor. We're going to be back in just a minute and finish this conversation. And then we're going to ask Dr. Jane to come back periodically because at the rate I'm getting the questions from his appearances, it's really a lot of fun to have him in here. So we'll be back in just a minute and finish this conversation.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB-TV and KWES-TV.